Epidemiologists say COVID-19 hotspots have evolved over the last several months. In the springtime, many case surges were linked to outbreaks at indoor locations like meatpacking plants and nursing homes.
Now community spread is making it more difficult to contain hotspots. KXAN's Maggie Glenn explains from the Capitol.
We were running short of staffing and other types of supplies and equipment.
So, doctors in the Rio Grande Valley chose to fly a COVID-19 patient to Northwest Texas healthcare system in Amarillo last week.
A critically ill patient with COVID who was on a ventilator due to the fact that they did not have critical care beds available at that time for this patient.
The 700-mile transport exemplifies the level of need in the state's southern region, a new hotspot.
We have let our hospitals know in that area that we are open to take some of the patients that they cannot accommodate if need be.
Amarillo faced a similar concern in May due to outbreaks at meatpacking plants and nursing homes, but stabilized once the state surged resources to the area.
When the state knew it was a long-term care facility or a meatpacking plant, it's one spot. You can go in and globally test everybody. When you have multiple zip codes that are having 200, 300, 400, 500 cases in that area, much harder. We essentially had a campfire, and it's a lot easier to put out a campfire. We didn't put it out completely. And so the embers from that campfire have now spread into the forest, and we have a full blaze.
Infectious disease specialists say more testing and personal responsibility are key to putting out the flames for good.
Wear the mask, watch your physical distance, wash your hands as much as possible, and I add the +1 is watch your symptoms.
Maggie Glenn, KXAN News.
Governor Greg Abbott just announced that he held virtual meetings with mayors, emergency managers, hospital executives, and other local officials in South Texas today. He said more resources are heading their way, including 5 U.S. Navy teams to provide support in Harlingen and Del Rio, Eagle Pass, and Rio Grande City hospitals. In the Rio Grande Valley, funeral homes have run out of space. Many of them are using temporary morgues and crematoriums. That's according to our media partner, the Texas Tribune. The federal government has sent mobile morgues to that area. The Tribune reports the Rio Grande Valley is one of the hardest hit areas. In Hidalgo, 284 people have died. Its population there is only 870,000. In Travis County, 3 mobile morgues are on the way as a precaution in case they're needed. It's not clear when they'll arrive or where they'll be situated.